Hello, my name is Pauline RN. Welcome to my channel. Today we are talking about pharmacology and I am on part 2. Questions and answers from RN Nclex examinations. Please hit the thumbs up button. Please subscribe to my channel. Please share this video. Thank you. My first question: which name is assigned to a drug by a manufacturer that first developed it? Which name is assigned to a drug by a manufacturer that first developed it? The correct answer is generic name. Next question: most drugs are excreted through. The correct answer is the kidney. Medication. Next question: all medications from home. What should the nurse do with medications coming from home? Correct answer: the nurse should return medications home. If there is no one present to return the medications with, the nurse should keep in a safe or in the security department. The nurse should keep in a safe locker. Medication should not be kept in the patient's drawers at the bedside for fear of overdose. Some patients, they have medications in their bags. The nurse is giving them the same medications. Maybe the nurse is late with medications and they are used to taking their medications at a specific time in the mornings. They will enter their bag and take their medication, and you will come to the bedside and give it to them a second time. So all medication should be returned home. Make sure you talk to patients about their medications on admission. Make sure you send those medications back home. Medications that are needed not continuously are called what? These medications are called PRN is the correct answers. These medications are as needed. Medications that are administered in error. Who is legally responsible? And the answer is the nurse. She must complete an incidents report. Next question. A nurse is called away from the patient's bedside in an emergency situation while she is administering medication to the patient. What should the nurse do? The correct answer: the nurse should lock the medication in a room. Then, after she's finished, she will return back to the patient's room and continue to administer the medications. The nurse should the nurse should never ever leave medications at the bedside. Next question. Before you administer medications to your clients, what should you do? Check your patient's ID bracelet. Ask the patient the state name and date of birth. Before you administer meds, check the identification bracelet. If medication is needed in an emergency to achieve rapid absorption, what would be the route of choice? The correct answer: in an emergency to achieve rapid absorption, the medication should be administered by IV is the correct answer. If you are administering a medication to a patient, in order to reduce discomfort when administering a sub-Q or an IM injection, what should the nurse do? To reduce discomfort when administering a sub-Q or an IM injection, the nurse should use 2 needles. The nurse should use 1 needle to draw up the medication, discard that needle, and attach the second needle. Then administer the IM or the sub-Q injection. This will reduce discomfort is the correct answer. Next question. When administering medication that has increased possibility of drug toxicity due to age-related factor, RN should consider what? Correct answer: elderly patients have decline in liver function and production of enzymes needed for drug metabolism. Correct answer is elderly decline in liver function, production of enzymes needed for drug metabolism is the correct answer. When you're giving an IM intramuscular injection, what is the correct answer and what is the correct angle? The correct answer is 90 degrees is the angle for a IM injection. What is the correct angle for sub-Q injection? The correct angle for a sub-Q injection is 45 degrees. Steps for medication errors. If you have a medication error, what are your steps? Check your client's condition, stat. Observe adverse effects. Check your patient's vital signs. Notify your doctor, notify your manager. Complete an incidents report. Write in your nursing note a description of the error in your nurse's notes. Document remedial steps that were taken due to this error is the correct answer. My next question: what will you do for narcotics safety? How do you keep your narcotics safe? Correct answer: narcotics should be locked away. Some medications need 2 nurses as witnesses. Example, your insulin, your heparin IVs. Use clearly labeled medications. Check expiration dates on your medications. Never leave the bedside in an emergency without taking your medications with you. Lock medications away for safety until you return. These are all safety tips for your narcotics. Your patient is praying when you enter the room. What do? The correct answer: leave the room with your medication and return later is the correct answer. If your patient is in the bathroom and you come in with meds, leave the room with the medications and return later. For medication safety, always watch your patient swallowing your medication before you document. Some patients do not want to take the medication. If the patient refuses, document refuse. Let the doctor knows the patient has the right to refuse. Do teaching, do open-ended communication. Let the patient know you were not the one who ordered the medication. Let them know the doctor ordered. If your patients have difficulty swallowing meds, you crush them, patients still have difficulty swallowing the oral medications, for example Tylenol, you change it to liquid, patients still have difficulty swallowing, notify the doctor, will order a speech therapist to come in and do a swallow evaluation at the bedside. Patient NPO, nothing by mouth. Okay, thumbs up this video please. Please subscribe. Please share this video with your classmates. Have a blessed day. I have part 3 on pharmacology coming up next. Thank you.